Hi, this is Suzanne, and you're listening to Sex Advice for Seniors, episode 100 and something rather. There's been a lot of these, but today I'm pretty excited. I'm really excited actually, because I'm speaking to someone who's a little bit of a superstar. I say little bit, he is a superstar. His name is Dr. Judson Brandeisto. You're calling from all the way in the West Coast, aren't you? You're somewhere in
Northern
the West,
California. Yeah.
Northern California. I was just in Napa and it was fab.
Oh,
Um,
yeah.
and he's a urologist, a sexual medicine expert, he's a sex educator. But what we're going to talk about today is that topic that often gets swept under the carpet, except, of course, when you're talking about the blue pill, which is men's sexual health and what men can do really to improve their sexual health, especially when they're over 60 years old. So, welcome to the show.
Well, thank you. It's so nice to be here. I really appreciate you having me on.
Thank you. So listen, I had a glimpse at your website, looked it over, and there were a whole bunch of different treatments that honestly I knew very little about. And I suspect most men, especially in the UK, which is where I'm based, really only know when it comes to erectile dysfunction, the blue pill. But it but looking at your website, there's like so many different kinds of options. What are the common complaints and things that men come to you for when they're a bit older?
Yeah, I mean, there are two main things that men come to see me for. One is erectile dysfunction, or the inability to get and maintain an erection sufficient for penetrative intercourse. And the other is for testosterone replacement.
Right.
Right.
And what how does testosterone replacement does that enhance your ability to have an erection as well, or do they come for testosterone for some other reason?
Yeah, I mean, testosterone and erectile dysfunction are basically parallel tracks, right?
Okay.
So testosterone gives you better libido,
Uh-huh.
but erectile function is really a function of blood flow. And so testosterone really has nothing to do with blood flow.
Oh, interesting. And I know that I've been on this testosterone journey that I just started myself, mainly because I read that Kate Winslet is swearing by it, and what's good enough for Kate is really good enough for me. I thought so. I thought I'd give that one a go, but it's a fairly laborious process for a woman to get testosterone, but I guess it has the same effect.
Right. So both men and women have levels of testosterone and estrogen. And even though men are from Mars and women are from Venus, the difference in a molecular structure between testosterone and estrogen is a single hydrogen atom. So the smallest unit of matter that exists is the main difference between testosterone and estrogen. So your body is able to convert testosterone into estrogen, which is how men get most of their estrogen. Now, for men, so you're 12 years old, your testosterone's 200. 6 years later, your testosterone's 1,000. You've grown a foot. You put on body hair, you put on muscle, you've taken off fat, you're chasing girls around the parking lot, right? And then your testosterone peaks out at around 20 years old, and it decreases about 1 or 2% per year after that, right? And so by the time you're 60 or 70 or 80, maybe your testosterone's 400 or 300 or 200, and you're losing muscle, you're losing libido, you're losing energy, you're not sleeping as well, your bones and joints aren't working quite as well. And so for men that want to get physically and mentally and sexually rejuvenated, testosterone replacement is really an amazing thing, right? So it helps with your libido, it helps you build muscle, helps you burn fat, helps you sleep better, helps you repair tissue, your aches and pains kind of go away. I mean, it is kind of the miracle. It's not a drug, it's a hormone, right?
Yeah,
So
yeah.
now for women, testosterone has very similar effects, right? So it helps women build muscle, it helps women build libido. I mean, I have guys that come into my office and they're like, Doc, you got to help me. My wife went on testosterone and now she's chasing me around the house for sex. He's like, I've been dreaming about this all my life and I'm too unmotivated to do anything about it.
Yeah.
Yeah. So, couples balancing is really important in that respect.
And that's really funny. And because, I've spoken to various people about women taking testosterone, and they've said it does depend on whether you use a cream or a pill or whether you inject it. Is it the same with guys? Are you prescribing it in different forms, or is it typically in one form when we're talking about men?
Yeah. So, typically men, the range of testosterone is anywhere from 300 to 900 or 300 to 1,000. And typically I'll get my patients who I'm doing testosterone replacement on, especially if they're in their 50s or 60s or 70s or 80s, over 1,000. So I'll
Oh,
get it between 1,000 and 1,500. Now, a women's testosterone level is 20, 30, 40. It's lower. Testosterone is more potent in women, so women get sort of more bang for the buck. But getting their levels to 50 or 100 or 150, will have a dramatic effect in women.
oh, interesting. And is that only through injection, or can you get that as a pill as well?
Yeah, so that's a really good question. For men, in order to get the levels over 1,000, I either have to use injection therapy or pellets. Okay.
Oh, right. Okay.
Everything else, anything transdermal like creams, gels, patches, any of those kind of things don't give levels high enough that I think are effective. Now, women, it's different, right? To get a woman to a level of 50 or 100 or 150, you can use creams, you can use gels, you can use pellets, you can use injection therapy, but that's probably not necessary to inject a woman because the levels don't have to be nearly as high as they are in men.
Yeah, yeah. Although I've been told, reliably told, that if you do inject a woman with testosterone, that there are some other kind of side effects that take place where certain parts of their anatomy might start resembling a small boy.
Yeah, I mean, you get it's testosterone, right? So you
Yeah,
get what's called clitoral hypertrophy, right? And you get some facial hair.
yeah,
You get masculinizing characteristics. So I mean, it's a balance, right?
yeah, 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 yeah.
And for men too. I mean, if you put a man on too much testosterone, then their estrogen levels will start to creep up and they get growth of breast tissue, breast tenderness. Some men buy Barbara Streisand albums or they go to Celine Dion concerts.
Yeah. Yeah. Well, yeah. I mean, yeah, that's okay though. I don't mind that. So let's go on to some of the other treatments because I know that we were talking just before the show about Viagra. And actually I did an interview for a newspaper yesterday talking about women and Viagra, not in terms of women taking Viagra, but women's response to men taking Viagra. And I know that some men have said to me, not me, but some men have said that women that they've been with have said, I would rather you didn't take that because it suggests to me that maybe you don't find me attractive or maybe I'm not sexually desirable to you anymore. And I think how many men come to you with that kind of wanting to obviously do something about the fact that they're not able to stay hard enough for as long as they'd like, counterbalance with, the psychological impact of having ED.
Yeah, I mean, some men come to me and they say they want to maintain kind of quote natural erections. They don't want to be dependent on a pill. And I can understand that, but realistically as you age, things don't work as well. And for the same reason that men um, need heart stents or heart surgeries or statin drugs or things to keep blood vessels in the heart open, men need things to keep blood vessels in the penis open. And, I mean, Viagra and Cialis are really miraculous drugs. I mean, I don't think you see too many men saying, listen, I don't want to have heart surgery because I want to keep my heart vessels open naturally and I'm willing to die
Yeah.
just to do that because I don't want surgery because it's unnatural, or I don't want a heart stent because it's unnatural. I mean, give me a break.
Yeah.
If it's not working or if it could work better and there's a pill you can take, and that pill is incredibly safe.
Yeah.
I mean, incredibly safe. You get the side effects of those pills are a stuffy nose, headache, facial flushing, some reflux.
Mm.
People aren't keeling over from taking Viagra or Cialis. I
Yeah.
mean, and hundreds of millions of men have taken these drugs. So the side effect profile and the safety profile of these drugs are incredibly well known, and it's been out for 30 years. It's not like
Yeah.
a COVID vaccine that's out for a couple of weeks, and people are being told to take it. I mean, I'm on my sixth or seventh COVID vaccine. I was actually part of the initial study, Pfizer study.
Yeah.
I was the 8,000th patient in the country in the world to have taken the Pfizer vaccine. So I'm all in for medical science, but I mean, give me a break.
Yeah.
The track record of these medications is like bomb proof.
Yeah, yeah, but look, as a woman, I know that I started taking vaginal estrogen I guess it's been about a year now, and I and up until that point, I thought that some of the symptoms that I was experiencing, pain during intercourse, like tears, just really, it wasn't pleasant.
Well,
And I
is that
thought,
because you don't love your partner?
but and
That
I
you're
was
not vaginally lubricated properly?
that's right. But I was
Like, you
recently
don't love me. Your vaginal lubrication isn't what it used to be.
but yeah,
No, it's getting old. That's what happens, right? You don't get as much blood flow to the penis. That's what happens. You don't get as much blood flow to the female genitalia. So
yeah.
you don't create as much lubrication. That's what happens. Just accept you're getting old and fix it.
Yeah, but listen, people don't talk about this shit, right? So even as someone that talks about this all the time and was using lots of lube and stuff, and it just wasn't doing quite what it enough. And then it was somebody else who actually turned me on to vaginal estrogen, just somebody, a friend of mine. And then it was literally miraculous. But firstly, I think we need to, as you said, we're getting old. We have to acknowledge shit happens and we have to deal with that, right? So that's the first thing that we have to deal with is we're getting old, which is sometimes quite difficult for people to deal with, right? Because I know, especially I was with a guy, sadly he's not with us anymore in the world, but when he started to experience erectile dysfunction and he was in his early 60s, for him, up until that point, he'd been kind of grooving along, he'd been able to get a hard on. We had sex. It was good. It was fine. And then one day it started to become a little bit more of a problem. And at that point, he was like, "Oh, the equipment's not working so well." Now, I did the same thing you did. I just said, "Honey, you're getting old. You're 63 years old. Wake up. You don't have so much testosterone. The blood's not flowing so much down there. Well, just go and get the pill. Just go and get the pill." But that really was something quite significant for him to have to hear because up until that point, he was kind of grooving along. Similarly, for me, I was grooving along in my lubricated world until 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 one day,
I mean,
until one day
like,
I wasn't, and then I had to. There's a path. Like there's a journey you go on, right? To deal with all this shit.
yeah, I mean, absolutely. It's it's a journey, and you just have to accept that things change.
Yeah, yeah, but
I mean,
people don't like change.
fortunately, we actually have medications that actually work. I mean, like, don't bemoan it. Like, thank your lucky stars that
Yeah,
these things actually exist.
yeah. So some of the other things you're talking about was your incredible find about, and I want you to explain it, about the even more incredible results you can get with a few nifty combos packages.
Well, I mean, I have a whole algorithm that I use for men when they come in to see me, but foundational to that is a nitric oxide booster. And so I created the Affirm nitric oxide booster, but yeah, Affirm's not the only nitric oxide booster out there. And when I was at UCLA, one of my professors, Dr. Lou Ignarro, won the Nobel Prize for discovering how nitric oxide opens up blood vessels. And then Ignarro and Jake Rafer, who was another one of my professors, actually discovered how Viagra works, which is, okay, so I'll throw a little biochemistry because I'm sure your listeners are very, very intelligent and astute.
They are.
So nitric oxide, which comes from watermelon, beets, green leafy vegetables, gets released by nerves, and it makes something called CGMP. And CGMP creates a cascade that opens up blood vessels, right? And this happens in any mammal: men, women, cats, dogs, rhinoceroses, giraffes, any mammal from head to toe. All blood vessels use nitric oxide to open up. Okay. And they do that by making CGMP. Now there's an enzyme called PDE, and PDE breaks down CGMP, right? So that blood vessels don't stay open forever. And really the discovery with Viagra was that Viagra is a PDE5 inhibitor, right? So PDE5 is only in the penis. And that's why those medications work so well. But there should be a synergistic effect between a nitric oxide booster and a PDE5 inhibitor because they're both keeping CGMP around. Mm-hmm. So the first thing we did was we had our study participants take the Affirm nitric oxide booster before they went to sleep, and we used what's called the FirmTech ring. It's a ring you put around the penis that has a pressure sensor that can determine your nighttime erections. And for those of you who don't know, nighttime erections are critically important for your daytime erections, right? When you're asleep, you should be getting anywhere from 3 to 6 erections every night that last anywhere from 5 to 10 to 20 minutes. And what we found is that taking the Affirm nitric oxide booster increased nighttime erections 30%. And I'm actually presenting that later this month at the Sexual Medicine Society of North America. Now, the follow-up study to that is, theoretically, if you take a nitric oxide booster and boost CGMP, and you take a PDE5 inhibitor like Viagra and you block the breakdown of CGMP, you should get an extra boost. And why is this important? Well, this is important because a lot of men out there can't take a full dose of Viagra or can't take a full dose of Cialis because they get side effects. They get headaches, they get facial flushing, they get reflux, they get muscle aches and pains, they get blocked or sinus congestion. And so if Viagra, 100 milligrams of Viagra is your effective dose, but you can only take 50 or you can only tolerate 50, you're 50 milligrams short. So what we found, or what we're finding so far in the study, is that by taking a nitric oxide booster like Affirm, you can increase the effectiveness of Viagra because they're both creating or preventing the breakdown of cyclic GMP. And so, this is early in the study, but what we're finding is really going to be a major finding, is that taking a nitric oxide booster while you're taking a PDE5 inhibitor like Viagra and Cialis can definitely improve the effectiveness of those medications.
And so with the nitric oxide, do you take it alongside the Viagra? So you take it at the same time, or does it not really matter at what time you take it?
Well, I mean, the amazing thing about nitric oxide boosters is they do an incredible amount of things, and there are really no side effects. So first of all, I use them as blood pressure medications on my patients. So a lot of men over 50 are on blood pressure medications, and blood pressure medications are detrimental to erectile function. So if you can replace a blood pressure medication with a nitric oxide booster, you're so much better off in terms of erectile function. Now, I wouldn't recommend, just not taking your lisinopril or your metoprolol. I'll talk to your physician. But what I typically recommend is get a home blood pressure machine, check it 8 a.m. in the morning, 8 in the evening, record it, then take a nitric oxide booster like Affirm, record it for a week, and then stop your blood pressure medication or drop the dose of your blood pressure medication and keep following your blood pressure readings. And if your blood pressure readings are still good, then you can talk to your physician about stopping your blood pressure medication, because it's a natural way of decreasing blood pressure. And the thing is, there's no drug company that's ever going to do the study of a nitric oxide booster for blood pressure medication because, there's no money in it, right? So, I mean, anyone can take watermelon and beets and create a nitric oxide booster.
Yeah. I mean, and of course that's the whole thing about pharmaceuticals in general is that there's an I did a documentary last week I filmed for the BBC, and there was one man in our small group. It's just a small group of us, 78 years old. He started experiencing erectile dysfunction. Then that led to him finding out he had an enlarged prostate, which of course we know is not unusual. And then he was put on medication where he was told, well, one of the side effects of this medication is your dick's not going to get hard. Right? Like, and said with that degree of lack of concern. Like, this man who still wanted to be sexual, why not? Was just told, yeah, well, that's so.
Yeah, I mean, I think that's really sad. It's at least in the United States, you're not taught very much, if anything, as a physician about sexual function or
No.
sexual medicine, right? So it's like, oh, you're 78, you're not having sex. Bullshit, right?
Yeah.
I had a guy a couple of years ago, he was 91. He's like, and I was seeing him for enlarged prostate. And at the end of the visit, he leaned over to me and he said, "Can I ask you an embarrassing question?" I was like, at 91, what could possibly be embarrassing? He said, "Can I get some Viagra samples?" I said, if I was 91 and I was asking for Viagra samples, I would put that up on the billboard on the roadside. I said, I wouldn't be embarrassed about that.
Yeah, well, I mean, look, I was with a guy back in 2004, was diagnosed with liver cancer, very late stage. He was a heavy drinker. None of it came as a great surprise, unfortunately. The doctor said to him, "Is there anything I can do? Sorry, sorry about all of this." It was very sad. And he said, "Yeah, I'd like some Viagra, please, because I just want to have some happy times and I just want to have lots of sex with my girlfriend. Thank you very much." And the guy said, "We can talk about that at your next visit. I don't think
Oh, God.
He said, "I don't think that's appropriate for this visit." And, I mean, I really, really hope for everyone's sake that times have changed, but I know that there is still even even when you speak to urologists, I know that there's quite a few urologists for whom the sexual side of their business, if you like, is something that kind of like comes with the territory because that's your equipment that you're dealing with. But often I find that the sex stuff, they don't really want to talk about it too much. They're happy to talk about prostate issues and prostate cancer and stuff. But when it comes to sexual pleasure, it's like, don't they go hand in hand here?
I mean, most doctors are very uncomfortable talking about that kind of stuff. I mean, just to be bluntly, perfectly honest, listen, we're all like type A personality. We spend all of our time in high school and college in the library trying to get into medical school. We spend all our time in medical school cooped up in the library trying to get into residency. We get bombarded during residency. When I was doing it, we were on call every third night. So, you get out, you're 30 some odd years old and you're maybe as a group, less experienced in these matters than say other folks. And then you're like thrown in the clinic and people are asking you about these things and you don't know what to say. You're like, well, I can fix your prostate or I can fix your heart, but fix your dick, give me a break. I mean, there's such a stigma. Like, think about it this way, right? You're at work, right? And you announce to your coworkers, listen, guys, I have to take my dad to the cardiologist. He's having some heart problems. And everyone in the work is like, oh, that's so nice. You're such a good son, taking your dad to the cardiologist. So then a week later, you're like, hey, listen, guys, my dad is old and he's having erectile dysfunction and he can't get his dick hard. And I need to take him to the urologist so that he can get a penis implant. Do you think you're going to get the same response from the people at work?
Yeah.
No, of course not. But there's such a stigma attached to it. But it's actually the same physiologic issue, right? The blood vessels are getting clogged to the penis. The blood vessels are getting clogged to the heart,
Yeah,
right?
yeah.
Like if you need Viagra, deal with it. You know,
Yeah,
you're not gonna not take a heart medication because you want to fix your heart naturally. I mean, you should be trying to fix your heart naturally. You should be exercising, you should be eating right, you should be meditating, you should be doing yoga, you should be out doing walks, you know, you should be decreasing your stress, you definitely shouldn't be smoking, you shouldn't be drinking. There are all these things that you shouldn't be doing. But at the end of the day, if you need a heart pill to
yeah,
stop from dying, then you take it. If you need a penis pill to stop your penis from dying, then you take it.
yeah,
And, you know, and a nitric oxide booster is like a total no brainer, right? It helps with blood pressure. It helps with penile circulation. It
yeah.
helps with cognitive function, right? So when I first started mixing up a firm, you know, I had a compounding pharmacy down the street from me. And so I was putting together L-citrulline, which is from watermelon, and beet extract. Beet extract has nitrates, which get converted into nitrites, which get converted into nitric oxide, and citrulline gets converted into arginine, which gives out nitric oxide, right? So these are nitric oxide boosters. And my 70-year-old patients, when I finished treatment with shockwave therapy, said, you know, can we stay on this? And I asked them, why do you want to stay on it? And they said, because we think better,
Oh, interesting.
right? Because your brain is entirely dependent on blood flow. And if you get better blood flow to your brain, you think better.
Yeah, yeah,
Right.
yeah.
So it doesn't do anything to the white matter or the gray matter of the
Mhm.
brain. It just brings more oxygen and glucose and nutrients up to the brain. And athletic performance, too. There's a big body of literature on athletic performance and nitric oxide boosters. And in elite athletes, you can improve athletic performance anywhere from 1% to 5% by putting them on a nitric oxide booster. Right. And that, you know, that's the difference between 10th place and 5th place.
Yeah, yeah, and, and what you're saying is, like, it's so obvious, but I'm always surprised at how people are so resistant to understanding that pretty much everything that goes on in your body is dependent on your blood flow, right? If the blood's not pumping effectively, then you're not getting a heart on, your brain's not getting enough blood, like, everything is affected, right? So,
Yeah.
if your blood flow is restricted, then obviously that's going to impact all sorts of things, including your erectile functions. But when I've suggested to men that, and I'm sure you agree with me, that if you've got some form of erectile dysfunction, then you have to look at where is the blood flowing effectively, because potentially that's your first problem, right? And
Well, yeah, I mean, you bring up a really good point, which is, what is your first problem?
yeah,
Your first problem is that you lose nighttime erections,
yeah.
right? That's the first key, that your circulation isn't as good as it used to be.
Mm,
Okay, 10 years after that, you'll develop erectile dysfunction.
mm.
Okay, and if that doesn't ring a bell for you, then 10 years after that, you're going to end up with a heart attack or a stroke or some cardiovascular complication, right? That's the progression of blockage in your arteries, right?
Yeah,
Because the arteries to the penis are 1 to 2 millimeters
yeah,
and
yeah,
they're peripheral. The arteries to the heart are 3 to 4 millimeters and they're central.
yeah, yeah.
So you're going to block the peripheral arteries 10 to 20 years before you block the central arteries. So it's like you're getting a 10 to 20 year head start on trying to prevent heart disease. If you're stupid enough not to listen to your body and listen to what your body is telling you, you know, what can you do?
Wow.
And then in 20 years later, you're like, well, I want to fix my heart problem naturally. I don't want to take any heart medicine. Like, you missed the train. The train was at the station 10 and 20 years ago.
No, that's right, and that's the whole thing when people are like, "Oh, yeah, I know I should eat healthy food. I know I should do this. I know I should do that." No, no, it's not that you should, it's that you actually have to, because if you don't, the ramifications of that, as you said, is like you might not see them for 10 years, and then 20 years later, you're gonna end up like 50% of guys over 50, right, with ED. And that's like, pretty startling stats. That's why I get quite passionate about this, is because the stats for vaginal atrophy are also really significant. But when I
Oh
hear
yeah,
the stats
huge.
like huge, but they're pretty much the same, to be honest. Like it's like 50% of women over 50, and I've heard 50% of men over 50 have experienced some form of ED, right? So
Right, but it's always the other guy.
yeah,
Right? It's not me. If it's one out of two people, I'm the guy that's okay. It's the other guy that's the problem.
right? But it's these are really significant numbers, and the fact that nobody's talking about it, as you just said, like no one's talking about it, it's ridiculous because
Yeah. Well, I want
because
to send you a copy of my book, The 21st Century Man.
yes, please
Right. So
do.
I have chapters in this book that deal with all of this. And I have a great chapter written by a friend of mine, Russ Bartels, who's a male gynecologist, called What Men Need to Know About Menopause.
Oh, great.
Right. The same way that women get involved in men's health, men should be at least aware, if not involved in women's health, and understanding some of the hormonal issues that women undergo and what happens to the aging vagina.
Yeah, yeah, absolutely. I mean, when I started this podcast a few years ago, my co-host then was a guy that I was kind of going out with, and he said to me after we'd done this for about 6 months, I said, "What have you learned in these 6 months, Peter?" And he said, "Honestly, you guys have so many problems." He said, "Who knew?" He said, "Honestly, I was so naive when I went into all this. I just had no idea how much shit you guys have to go through, like, throughout your whole life." And I was said, "Welcome to our world," and but yeah, I mean, men don't but women, I think it goes both ways. I don't think, like I said before, I think women take men's dick going up and down very personally when most of the time it's got nothing to do with them. It's got to do with something that's going on with their own bodies, and they need to be more sympathetic in those situations rather than say, "Hey, what's happening here? Don't you love me anymore?"
Well, yeah, I mean, that's the issue. And that's what people have to understand is that there's two phases of the nervous system. That's called sympathetic and parasympathetic, right? So say you're a caveman, right? And you're in a cave with your cave woman, and there's a saber-toothed tiger outside, and it's pacing in front of the cave, right? So you're in what's called full sympathetic outflow, right? So adrenaline and cortisol are the stress hormones that you use. And when you're in stress mode and you're going to be attacked by a saber-toothed tiger, you want your blood going to the muscles, to the brain, to your eyes, right? And that's it. Going to the intestines, you don't want that, right? Because you don't need to digest food. Going
Yeah,
to the kidney, you don't need to make urine. Going
yeah,
to the penis, you're not going to have sex with the tiger. You're going to try to fight the tiger, right? So then 2, 3 days go by, and your cave woman is starting to get a little anxious. She's like, I'm getting sick and tired of being in this stupid ass cave, and you need to go out and fight this tiger. And then another day goes by, and she looks at you and goes, my ex cave boyfriend would have kicked this tiger's ass, and you're just a wimpy ass piece of crap, and you're just sitting there. And so by day 6, it gets so abusive that the caveman was just like, you know what? I'd rather take my chances against the saber-toothed tiger than spend another minute in this cave. So he picks up the spear, he charges out of the cave, he kills the saber-toothed tiger, right? This massive sympathetic nervous system outflow kills the tiger, and collapses on the ground, just exhausted, right? So then, 10 minutes later, he's pulling the saber-toothed tiger back into the cave. He skins the saber-toothed tiger, puts a nice saber-toothed tiger rug out on the floor of the cave. He's got the saber-toothed tiger meat on the spit, right? Now you go from sympathetic outflow to parasympathetic, right? So now your intestines are digesting the tiger meat, the kidneys are making urine, and then you settle down on the tiger skin rug with your partner and you procreate,
yeah,
right? And so you're in full parasympathetic outflow. So the blood is not going to the muscles you need to fight the tiger.
yeah,
Your
yeah.
muscles, I mean, your blood flow is going to procreation. And then you reach orgasm or climax, and that is a full sympathetic outflow once again, because the thing is, if I'm looking out onto a big grassy field and there are squirrels out there. When squirrels are copulating, they stand still.
Yeah.
When a squirrel stands still, the hawks in the area are circling around, getting ready to pounce on Mr. Squirrel. So as soon as Mr. Squirrel's done with his business, he's up and ready to fight again or to run away. And
Yeah.
so the thing is, there's only one sympathetic and parasympathetic nervous system, right? The same system we have built to protect us from tigers also gets triggered when, you have a problem at work and your boss is mad at you,
You're stressed.
or
Yeah.
or your spouse says, you don't love me anymore, you can't get an erection, what's wrong with you,
Yeah.
right? So that situation just makes it worse.
Yeah. 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 For sure. For sure. So yeah, ladies out there, just be sympathetic towards your guy, and everybody's going to get what they want. That's my closing statement. Just be nice. Just be
Just
nice.
be nice.
Just be kind. Just be nice, and go get yourself some nitric oxide. I'm going to get myself some nitric oxide after this, or you're going to send it to me.
I'll
And
send it to you. I'll send you a
that's,
copy of my book too, and you'll
God,
see there's so many amazing chapters. They basically cover all aspects of men's sexual health, including, I don't know if we had much time to talk about some of the new nifty drugs out there, like the PT141 peptide or apomorphine or oxytocin, or low intensity shockwave therapy, or Botox injections for the penis, or
yeah, there's loads of stuff. The guy that I'm with's just been taking peptide injections, actually. And yeah, seems to
for
be
for
something.
for what?
I don't know, but he looks great. So
Yeah. So I mean, what a peptide is just a string of amino acids.
yeah.
That's all a peptide is. So insulin is a peptide, but there are specific peptides that do certain specific things.
It's for muscle building.
Yeah, so he's probably on BPC 157, which is supposedly helps muscle recovery.
Yeah, exactly. That's the one. Anyway, it's been lovely to speak to you. I normally do 30 minutes, but this has been a very interesting 37 minutes. I could make it 57 minutes, but then, yeah, we find,
We'd have to pop some Viagra if you want to go that long.
yeah, I call it a Viagra party.
Yeah, or if we want to go an hour, we just pop some Affirm and some Viagra, and then we're good all night.
We're good to go. Well, you never know. I might be in Northern California, but I haven't asked your marital status, and we don't need to go there for this purpose. It's been really lovely to speak to you. Oh yeah, he's got a ring on it, and not as Elliot would say, you got to put a ring
Yes,
on it when
there
you're
you
over
go.
50. It's on his finger, ladies and gentlemen, because we don't show the video. It's on his finger, not in the other place. Anyway, it's been lovely to chat to you. Thanks very much. We will be I will put the link to your book and all the rest of it. And
Awesome.
yeah, have a great day.
You too. Bye-bye.